Okay, well, good morning, everyone. It's 11 o'clock, so let's go ahead and get started with our webinar this morning. I want to welcome you to this month's Animal Care Wednesday webinar. My name is Amy Schleicher. I'm listed as Kim Clark in the participant list there, but I'm filling in for our committee chair, Heidi Carroll, who couldn't be with us today. So the Animal Care Wednesday webinar is a monthly webinar series on topics of interest related to animal care, and it's a multi-state collaboration between Iowa, Nebraska, Missouri, and South Dakota. And so again, we welcome you to this morning's webinar, which is going to be on common poultry health issues. And our speaker this morning is Dr. Sheila Purdum, and she's a professor of poultry nutrition at the University of Nebraska-Lincoln. You know, in light of the fact that we have fewer and fewer state extension poultry specialists and poultry vets as resources, I think this is a great opportunity to brush up on our poultry health knowledge, whether that's to help the increasing number of small flock owners that seem to be calling into our extension offices, or to help our 4-H Poultry Project members. I will let you know that today's webinar will be recorded, so if you would like to refer to it again at a later time, you're sure welcome to do that. And typically we'll have those posted in about a week on the Animal Care Wednesday website, which I have put the link for in the chat box. And mentioning the chat box, that is how we will be asking questions of our speaker today. So as we go along, please feel free to type your questions into the chat box, and when we get done with Sheila's presentation, we'll check in on that and get your questions answered. So I think that's all of the housekeeping I need to address before we get started. So with that, I will hand things over to Sheila.
Okay, thank you. I get a lot of small flock, 4-H, my chicken is sick questions and calls. And this is a basic kind of presentation. It's not exactly what I would usually like to have right before lunch because there are some yucky pictures. But we will go through the basic types of disease, and I'll talk a little bit about how we handle treatment of these different diseases, prevention, as I go through the presentation. There are basic 5 categories of types of disease that you might hear about or see in poultry flocks. They can be bacterial, which is not such a bad deal because they can be generally treated with antibiotics. Viral is more difficult, typically takes vaccine. Fungal, which also can be cleaned up with common disinfectants. Parasitic, often very common in backyard flocks, and then nutritional deficiency types of diseases. The bacterial diseases include things like E. coli. It might be something like a yolk sac infection due to dirty incubators, necrotic enteritis in the gut. There's a few that are kind of carried by waterfowl, fowl cholera specifically. And then you have salmonellosis, and even chickens can get TB. So these are probably, many of these are diseases that you're also dealing with other livestock and have similar treatments, actually similar antibiotics available to treat within poultry conditions. And I don't want you to kind of freak out about giving poultry antibiotics. It's quite okay to do so as long as they're cleared, just as it is in the livestock industry. Looking at one that can come from migrating waterfowl would include fowl cholera. And it's real important to separate the small flock or 4-H flock from migrating birds for a number of reasons. They can carry AI to your local birds. They can carry things such as this fowl cholera. So you probably are going to have a hard time keeping domestic ducks from migrating ducks if they're all utilized in the same pond, but do try to keep them away. This swollen wattles and sinuses is a typical fowl cholera infection. It's very hard to clean up without a specific prescription of high level of antibiotics from the local vet. They don't like doing that, but if you can get a hold of some terramycin or something like that, it will be very helpful. Tuberculosis can actually be picked up from other wild birds in the environment. And this is an example of a tuberculosis-infected liver. Many of you don't want to be doing necropsies of chickens, but it's actually pretty easy to do a chicken necropsy and open it up and see, you know, if you got these types of spots on the liver and heart, you obviously got issues. So it's not as difficult to find some of these issues in your poultry flocks as you might think. Salmonella is a biggie in the poultry industry. It's been around forever, different strains of Salmonella. Salmonella pylorum has actually been eradicated due to testings with the National Poultry Improvement Plan. It is the one, when you get a certificate from the hatchery where the chicks come from, it usually should say that they're salmonella free. In fact, it's a federal requirement that they've been tested for Salmonella pylorum and they're coming from a hatchery free of Salmonella pylorum. The other types of Salmonella that are big issues are the ones that make us sick, such as Salmonella enteritidis, which actually is a foodborne illness in eggs. And fortunately now there's a vaccine available, and it's one that, again, the hatcheries have the opportunity to vaccinate for several things, for E. coli, coccidiosis, and even SC. So as your backyard flock owners and 4-H projects are planning for new chicks coming this summer or this spring, I think it's important they talk with the hatcheries about what vaccines are available and order those vaccines. Don't be cheap. Order the vaccines at the hatchery. That's the easiest place for them to be administered. Turkeys, chickens can get respiratory infections, especially this time of year. If you have too many birds cooped up in a small space, infections of the sinuses become just as big of an issue as it is in any other livestock species. And this bird's obviously very, very uncomfortable and will not make it. Going into the viral diseases, there are very specific diseases to poultry, and for most of these diseases, there are vaccinations available. And the vaccinations may be available at the hatchery, but most are vaccinations available in the field. And very few small flock or 4-H flocks actually avail themselves of using these particular vaccinations. There's a whole list here, a laundry list. Fowl pox. Pox can be carried by pigeons and other birds. This laryngotracheitis, that's a nasty one where it actually gets in the larynx and the trachea, the virus. Newcastle disease is pretty well under control, but can also break. And I would say any of these diseases you're going to see in backyard flocks. If you happen to have a 4-H kid that wants to go to the local sale or marketplace auction facility, you have to be very careful about bringing outside birds into their flock because they could bring any of these viral diseases with them. Just to take a look at what's happening, the bursa, which is basically the major organ that produces the immunoglobulins in response to vaccines, can be swollen, can become infected, and it's a huge problem in young poultry. Hopefully, again, they are purchasing chicks, getting birds from a known clean hatchery or flock. These are particularly diseases, virus diseases are communicated very quickly from one bird to the next. Fowl pox is similar to chicken pox. It's not the same. If the birds get it, the humans won't get it, but it can be communicated from wild birds to domestic birds. And I can't overemphasize enough keeping wild birds separate from domestic. It's very important. Something like bronchitis in the bird, you may hear some snipping in the flock, kind of some coughing even, and you may see eggshells which are mottled and misshapen, such as what you're seeing in this slide. So it's basically the bronchitis is disrupting oxygen and CO2 supply, and the shell gland actually needs CO2 to make the egg shell from carbon. It's calcium carbonate. Very important to observe what's going on with the shell quality too. This is an easy one to vaccinate for. You can actually vaccinate for this one in the water. And so if we see this in commercial flocks, they'll actually go in and boost. But typically the pullets are also boosted for this particular virus by giving vaccine. Merrick's is one that I see in older hens and birds. A hen can live a long time in a backyard flock. The longevity can go anywhere all the way up to 8 to 10 years. In fact, I have seen 4-H birds kept properly last a very long time. But this Merrick's is something, again, typically can be vaccinated at the hatchery or vaccinated in the breeder flocks, but the birds lose immunity to it, and you will see a paralysis where the bird will actually be bending its head and having an abnormal gait. And it can be transient and brought back, but I don't see it very often. So those are all of the, what I want to call viral diseases. There's good vaccines available, but not always in small quantities. So again, it's very important to have your backyard flock and 4-H project people buy from a reputable hatchery that is vaccinating for as many of these particular viruses or diseases at the hatchery. Fungal diseases are more controllable by management. Aspergillosis can occur in a chicken just like it does in a pig or any other livestock species, and it's typically due to moldy grain or a moldy fungal environment where the manure's not getting cleaned up. So good management is going to prevent a lot of these diseases. And I can tell when I go out to fairs and look at chickens that facilities are not kept dry enough. All you have to do is look at the foot pad. Just tip your chicken upside down. Look at the foot pads. If they've got black spots, it's indicative of the fact that the facilities and the litter have not been kept dry enough. All right? Or if they have moldy feed, let's say they put feed out in the open environment, it gets wet and it's not cleaned up when it's old and moldy. These cause problems for the chickens, okay? Just as they would for any other animals. So these types of diseases, I feel, are very management related and very preventable with good management. Same thing on parasites. I really hate talking about parasites. They make me itchy all over, but there's a whole host of parasites that challenge our birds, and especially our backyard birds. The first one being coccidiosis, similar to coccidia in other species, any type of animal. Fortunately, there is a coccidiosis vaccine available now as well. Histoponiasis, don't hear a lot about that, but I sure do hear about lice, especially when show season comes in. They start handling the birds and they see foul lice on the birds. And we'll talk a little bit about how to control that as well as mites. And then the ascaridids, the worming, definitely chickens get worms just like any other animals. Going to coccidiosis, again, I hate to blame everything on waterfowl, but boy, they can carry in a lot of bad things to your poultry flock. And they are basically shedders. And so anytime you walk through waterfowl poop, you are bringing different disease organisms, coccidiosis, you could be transmitting AI. So let's say you do have a pond on that farm, definitely change your footwear, wash and disinfect your footwear after you've been fishing through that wildfowl poop before you come back and do your chores in your chicken barn, okay? It's what we call good biosecurity, and it is essential. Parasites, different worms. This is not complicated. Ivermectin is cleared for dosing poultry, swine, horses, sheep, pigs. I think about every livestock species has been cleared for use of ivermectin. And it is the best one. You just basically, if you can get it, put it in the water, if you can get the water soluble, and clean up any worms. It's very effective and readily available to the backyard producer. Lice. Oh my God, this is a bad one. You know that wild birds carry lice into poultry facilities, and it could be carried in just on a sparrow. We had this at the university a year and a half ago, and it got out of control, and we had to basically clean it up by dipping our chickens into giving them a 7 bath. So we got water-soluble 7, I made a bath in a large Tupperware container, type of Rubbermaid, and actually set the birds in there, holding them quietly, and we had to do it twice in order to get all the eggs and all the adults over a 3-month period. A lot of work, but if you don't clean it up, this can get out of hand so quickly, and it will literally suck the egg production right out of your chicken. Okay, it's a horrible thing. But the good news is you can go get 7 at any basically say Earl May type of store, probably even Walmart, and use something that's not very expensive to clean up what can become a huge problem. Same thing with northern fowl mites. This is the one that makes you itchy because these are the guys that like to jump from the chicken to the human. Now going back real quickly, fortunately, lice are very host specific. So we learned that the lice that were on the chickens will not go on humans. They don't like humans. They like feathers and chickens and wild birds. So the good news is even though it's a horrible thing to have to clean up, it's not a human worker safety issue. Going on to northern fowl mites, these little rascals, along with dust mites, like to jump on humans, and they will bite, especially the dust mites, not so much the northern fowl mite. And again, these can get into your facilities from wild birds. If you have a backyard flock, you want to make sure that you have a place to lock up your birds at night or in cases where you have an infection so that they are not interacting with wild birds, whether it be sparrows, whether it be waterfowl. Again, biosecurity cannot be overemphasized. These little rascals, they can get cleaned up with 7 dipping as well. So vaccination programs, I've talked a little bit about it. They are available at the hatchery. I think they are making great strides. In addition to the ones I have listed here, there are salmonella vaccines now available at the hatchery too. In the commercial industry, when you're growing 100,000 pullets for a commercial house, there are actually crews go in to add further vaccinations during the pullet rearing period. And those will be for primarily the viral challenges that can exist in the industry. Well, those aren't always available to the backyard farmer. I'm afraid I've had to tell numerous 4-H projects when something like bronchitis breaks or Newcastle, you can go buy a vial of vaccine and try to get it into your birds, but in many cases you're better off to depopulate, sanitize, and then bring in clean birds. It's very difficult to save older hens or older birds that have this particularly viral disease challenges. I want to promote biosecurity. In fact, if you want to invite me back to do a presentation later on, I have a whole presentation on biosecurity specific to how AI moved around the United States, and particularly here in the Midwest a while back. The National Poultry Improvement Plan, NPIP, exists in every state, and you would have a state body. Usually it's in the Department of Ag that regulates this particular plan, and it monitors diseases at a national level. In Nebraska, again, it's coordinated with the Department of Ag. So when avian influenza broke in Nebraska in 2000, and I believe it was 15 or 16, 15 probably, the state vet set up the zones of quarantine. That's their responsibility, along with the federal advisors. And they were also the ones who had the responsibility on canceling the fairs in order to avoid AI from moving from commercial flocks to small, or vice versa. So there's a whole federal template on how disease outbreaks are handled and quarantined. Okay, so I'm going to stop there. I hope that you could hear everything I had to say, and I hope it wasn't too gory right before lunch. Not too many of us eat chicken liver anymore anyways, but I realize that's not a pleasant thing to look at.
Thank you so much, Sheila. I tell you what, for those of you that are on the webinar, I am going to start a poll. And so while we're doing question and answers, if you want to fill in the little survey that I am launching right now, you can go ahead and fill that out, please. We'd like to get your feedback on the sessions. So if you have any questions for Sheila, if you could please type those into the chat box and we'll monitor that. Sheila, I do have a question for you while we're waiting for others to submit their questions.
Okay.
What are some of the, and I think that's one of the challenges as we work with small flock producers, there's a lot of, different issues that we've talked about here. And if you, try to figure out what's wrong with your birds, and it seems like some diseases look similar, have similar symptoms, but what would you say are the biggies, the most common issues that you see in small flocks?
All right. So the most common issues can be the parasites, and those aren't too difficult to identify. They're not fun to identify, but parasites, I would say on the viral side, bronchitis, and if they start snicking or coughing, that's an indication there's respiratory issues. Those are the two biggies. And then, the older hen that you've kept around for 7 or 8 years and it won't lay eggs anymore, that's an aging issue, and they pretty much will not have much immunity to anything left. So you can see something like the Merricks, where they kind of walk around hunched over, those types of things. I don't see a lot of fungal issues. Most people try to provide fresh, clean feed and a fresh, clean environment to their poultry.
There's a question in the chat box. Any best practices for biosecurity in our fairground poultry barns?
Yeah, that's a great question, and one, that concerns everybody. I think it's very important when the chickens are checked in to make sure that there aren't any swollen sinuses or coughing chickens. And the good news is you really don't see that much at the fairgrounds, because the fairs and everything is done in August, and most of these viruses are very heat sensitive. They don't like heat. I would say try to just check for general health issues as they are checked in, to make sure there's no swollen sinuses or eye issues or coughing. And then it's very important that the kids clean up the manure and keep their facilities tidy, obviously. And also important, I would say, to make sure that they're coming with clean clothes, clean boots, and not dragging manure from home to the fairgrounds. And then when they take birds home from the fairgrounds, if there's anything suspicious, they may want to isolate and quarantine them for 2 weeks. The judge will tell you real quick, the kids, if there's parasites on their birds. And those who have had parasites, they usually hear about it from the judge, and the judge is usually not very happy about it. In that case, I would ask if the judge sees parasite on birds, you might want to have a policy that those birds go home immediately, that they don't stay at the grounds. And I'm trying to get to my chat box real quick here, and I guess I probably need to get out of the, there we go. Okay.
What are some of your favorite resources, whether it's for the backyard flock owner or a 4-H poultry project member, good basic practical resources that you would recommend?
I like the story publications that are distributed by Murray McMurray and several others, Backyard Poultry Health. I'm trying to look if I have them on my shelves, and I don't have a lot of them on my shelf right now because I also have a 4-H club that I teach. Oh, I've got a couple of them here. Okay, so Story's Guide to Raising Chickens. If you can see me, this one's a good one. All right. Poultry Health and Management. This is another good little guide. And they get kind of serious. There's not a lot of pictures. The kids might not like it, but it'd be good for adults. And then this one in particular, Poultry Health and Management, is also a really good guide. This is Blackwell Science, published, you know, they're old. They're published in the 90s, but I'll be quite honest, not much has changed as far as poultry diseases other than AI and how it moves around from flocks. So those are some good guides. I'll be quite honest, I'd like to update the Broiler Project for Nebraska publications.
If anybody has any last questions, please type them into the chat box. I guess one of my last questions would be, first aid kit isn't what I'm wanting to say, but are there sort of those basic things that whether it's a small flock or the poultry project member, things they want to have on hand, kind of that basic good health kit?
Well, health kit and disinfection. Okay, so first of all, I didn't talk about this, but disinfection tanks were a foot bath with a disinfectant in it, like Clorox or something, just to help put your boots in after you've been walking around before you go into your coop to make sure you've basically destroyed any pathogens on your footwear. First aid's that's a hard thing for poultry, you know. Poultry may have an attacked by a predator that maybe only gets a little bit of the feathers, or it may completely damage a limb. In those cases, again, disinfecting the area, cleaning it up, and making sure that the bird has a quiet, clean environment is most important. Bird temperature is very high. It's very difficult to take bird temperatures as it is in mammals and find out if it's sick or not. Other first aid things, obviously a bleeding toenail. That's very common, in which a bird will snag a toenail on a piece of equipment, and having perhaps some, I want to say, blood clotting dust, such as you have with dehorner, or something to actually put and hold pressure. So a cotton ball type of or gauze to hold pressure to stop the bleeding of the toenails, very important. In the first aid kit, having toenail clippers, such as what you have for dogs, is also very helpful to making sure that the toenails do not get too long, such that they do get snagged up on equipment. Okay, I see a couple more in the chat. Suggested websites for youth. I really like Murray McMurray. I think they've done a very good job of putting out educational materials, and that's a good source of information for youth. Not to say that there aren't others, but that's one that I typically recommend people to is the Murray McMurray Hatchery website. Sprinkling on ground in coops to clean it up. Limestone or lime is a great neutralizer. And then basically spraying it down with a detergent with a disinfectant in it. Washing out your waters, cleaning up with disinfectant, I want to say shampoo, or not shampoo, but detergents will help neutralize and basically kill a lot of the bacteria. Those are good questions, everybody. It's really hard to clean a chicken coop without a complete wash down, again, with a detergent or a disinfecting detergent.
All right. Well, thank you, Sheila, so much for your presentation today. Great information. I think we all, oh, one last question that came up in the chat box.
Okay, low egg production. All right, so a lot of these questions come in the fall because the birds are not provided artificial light. So to keep egg production up, you need 16 hours minimum day length provided per day. And that can be through natural daylight as well as artificial light, such as with light bulbs. The problem in the fall is you have decreasing day length. It's going down, all right? And if you're not providing extra light through artificial light in the coops, egg production will go down and you'll see a molt. That's the natural process. So you must provide artificial light, but not 24 hours. You have to provide it only up to 16 to 17 hours per day. So that's the typical issue with low egg production. The other issue is an aging flock. Once those birds get to be 4 or 5 years of age, they're not going to produce as well as that 1 to 2 year old flock. Oh, and cold weather. We're having a little bit of that right now, and everybody's flocks are kind of backed off if they don't have supplemental heat. And most of us, I've got a small flock at home, and I don't give them any supplemental heat because I don't want to worry about the heat burning down the barn.
Okay, well, oh, one more.
Chickens that eat eggs. That's a really bad habit. A lot of people think that chickens eat eggs because they're hungry for protein or particularly the shell, but I think it's a bad habit, and it's primarily due from poor management. Not collecting the eggs daily in the morning and the afternoon. So if you leave those eggs out there and the birds start walking over the top of them and cracking them, of course they're going to eat them. So good management of collection of the eggs morning and afternoon will help prevent that. But once it gets started, it's very hard to stop. All right, these are good questions. I've enjoyed sitting with you.
We appreciate you, Sheila. Great presentation. So I'm going to tell everyone what the next topics are for the next sessions, and maybe there'll be another question that comes in. But so our next webinar will be on March 7th. Our topic that day will be sustainability's role in animal care and health. Where are we at? And our speaker will be Ben Weinheimer, who's the Vice President of the Texas Cattle Feeders Association. And then on April 4th, we're going to have a discussion on livestock housing, including monoslopes and confinement systems, care considerations for bedding choice and management, and our speaker will be Beth Doran from Iowa State University. She's a beef specialist there. So that's a couple of the next sessions that you guys can look forward to. If you're interested in reviewing the talk today, again, it will be it's recorded and will be posted in about a week on the Animal Care website, which that link is listed in the chat box. So you can scroll and copy that if you would like to. And if there are no other questions that have popped through, we appreciate Sheila again for her presentation today and appreciate you all for taking the time to view the webinar. So hope everyone has a great day and we'll see you in a month.
Thank you.
Thanks, guys.